Good morning, ladies and gentlemen. First of all, thank you, Dr. Pelouse and Jean-Paul, for inviting me here today. I'm delighted to be here. So the title of my talk actually is How Dietary Changes Can Rapidly Reduce Cardiovascular Risk, but the Bad Behavior of Big Food is Damaging Your Health. If I had known before I got here there were going to be so many representatives of the food industry here, I probably would have brought a bulletproof vest, but let's see how we get on. Okay. So I'm going to speak in a sort of broader perspective, not specifically about palm oil, but really, hopefully, enlighten you and provoke some thought within the audience. So, first of all, So in terms of the scale of the problem of obesity, which is something obviously everybody's aware of at the moment, to give you a bit of background, in the UK, 60% of the UK's adult population are now overweight or obese. Perhaps more worryingly, 1 in 3 children, by the time they leave primary school, are in the same category. So that's by the age of 11. Are overweight or obese in the UK. The Foresight report was a UK report which was commissioned by the Department of Health, and that suggests that if we do nothing, 90% of the UK population will be overweight or obese by 2050. It's currently costing the National Health Service in the UK £6 billion per year, obesity alone, but total cost of type 2 of diabetes, and that's loss of economic productivity, in addition to the NHS costs, is around 20 billion and is set to double by 2035, again, if we do nothing. Non-communicable diseases, diet as a major risk factor, have now overtaken undernutrition as a commonest cause of death worldwide, contributing to 35 million deaths a year worldwide, according to the United Nations. And what's already been alluded to by Dr. Pelouse's talk, and I'll talk about that briefly as well, is obesity just the tip of the iceberg when it comes to diet-related disease? So the root cause of this obesity epidemic, there's no doubt in my mind, is actually the food environment, the obesogenic environment that we live in. Processed food, energy-dense foods are everywhere. They've become unavoidable. So just taking that slide really, so you can see, for example, that a burger, fries, sugary drink, all of that contributes to a significant amount of calories just in one serving. Again, you cannot avoid these processed foods wherever you go, whether it's at the gas station, whether it's in office buildings, in health clubs, sugary drinks in particular. Junk food is everywhere. It becomes unavoidable. And perhaps from my point of view as a cardiologist working in a hospital, what I find most obscene is, and I've written about this extensively, is the fact that we even have junk food in hospital. Just look at that slide for a second. This is Guy's Hospital in London, and you have an advert there for McDonald's. What does that tell you? What does it give? What does it? The impression it gives is it increases the legitimacy or acceptability of these foods, that you associate them with hospitals. And I'm sure a lot of you here probably have experienced that in your own, when you've visited a hospital or seen a relative. So toxic hospital food environment, it's a branding opportunity for the junk food industry. I'll give you one example. In London, there's a Royal Free Hospital, like any hospital, it's not Royal Free in particular, but like any hospital, there is junk food availability within the hospital grounds. In the lobby, they have a particular store, which I won't name, which looks like a candy store. It used to be a stationery store. 50% of the store is just basically sugary drinks, crisps, junk food. What amazed me is when I spoke to the management, I found out that on average, there are 10,000 visitors per week who walk through that lobby. 10,000. So it becomes a brand. And so it legitimizes the acceptability of junk food. Even hospital trolleys, patients, for example, who are bedbound, people who have suffered heart attacks, they can't mobilize for the first 24 hours. Are they safe from junk food? No, because trolleys are carried around which carry sugary drinks and poorly nutritious foods to those patients who probably need nutritious food more than anybody else. What about education? Oh, yeah, it's about educating the public. Well, it's lack of education that's why people are obese. 50% of the NHS employees, nurses and doctors in the UK, are overweight or obese. That's 50% of 1.4 million NHS employees. So it can't just be about education. And then this perpetuates a revolving door of healthcare, in my view. If a hospital is promoting that environment, then people are more likely to be readmitted. I think it's common sense. So coming back to the food environment, so what about personal responsibility? Well, actually, according to Thérèse Marteau, professor and director of health and behavioral research at Cambridge, she says food choices are often automatic and made without full conscious awareness. So despite the fact that somebody wants to lose weight, you're still going to be tempted to buy that brightly colored chocolate or candy bar at the checkout till in the supermarket. The food industry know that. They're there to sell food. That's why these products are placed there. Who can blame them? That's what they're supposed to do. Again, it's not helped by aggressive marketing by junk food industry who target children and most vulnerable members of society. Fast food advertising alone in the United States is costing $4.2 billion. They spend $4.2 billion in the United States alone on fast food advertising. And just to give you a perspective in public health, for every £1 spent by the World Health Organization in trying to prevent diet-related disease, the food industry spends £500 in marketing high-calorie, low-nutrient foods. Where's the balance of power here? So what else did the food industry do that doesn't help in terms of the public health message? Focus on personal responsibility as a cause of the nation's unhealthy diet. But as we already know, the food environment doesn't help. Raise fears that government action interferes with personal freedom, so when we talk about regulation. But you've got to remember one thing, just to put it in perspective. If you look at greatest public health successes, whether it's safe drinking water, seat belts in cars, smoke-free buildings, they happen through regulation, not through voluntary agreements with the food industry, which give the impression of minor progress while detracting from more meaningful interventions. They also use corporate social responsibility. So at the time the city of Philadelphia was considering a sugary drinks tax, the soft drink industry very kindly gave a $10 million donation to the local hospital. Well, the sugary drinks tax didn't happen. I'm sure, well, anyway. The other things they do, I've been a target by the food industry, vilify critics with totalitarian language, calling people like me or people who are public health advocates as food police, leaders of the nanny state, or food fascists. And also criticize studies that hurt industry as junk science. Right, physical activity. So another thing they do is emphasize physical activity over diet. Well, actually, to be honest, I'm a very big promoter of encourage physical activity, lots of health benefits. But in relation to obesity is negligible. Negligible. In the last 30 years, as obesity has rocketed, there's been very little change in physical activity levels across the population. If anything, there's a suggestion that physical activity levels might have even increased slightly. And we must, learn from history. And I think there are similarities between tobacco and the food industry here. It took 50 years between the first links that were published in the British Medical Journal linking smoking and lung cancer to any effective intervention or regulation. And that happened because the corporate playbook by Big Tobacco included planting doubt that smoking was linked to lung cancer, complete denial, confusing the public, and even buying the loyalty of scientists, which I find particularly, that upsets me more than anything else. But whatever it takes to protect their only interest, which is profit. And of course, that's what they're there to do. And just again, give you a bit more perspective. In 1994, not that long ago, the CEOs of every major tobacco company went in front of US Congress and swore under oath they did not believe that nicotine was addictive or smoking caused lung cancer. Just a slide there. That, we had the Olympic Games in 2012 in London, and I gave a report for BBC Newsnight, which is a program over there, basically saying as a cardiologist, I thought it was pretty obscene that we had, the major companies that are associated with junk food, McDonald's, Coca-Cola, Cadbury's, being the main sponsors. It doesn't send out the right message. It's, it's a marketing platform again. Right. Moving on to cardiovascular disease and to the main point of the talk. So I wanted to give you that perspective, first of all. So CVDs are the #1 cause of death globally. More people die annually from CVDs than any other cause. About 17.3 million people died from CVDs in 2008, representing 30% of all global deaths. Roughly 50-50 between heart attack and stroke, a bit more for heart disease. Low and middle income countries are disproportionately affected, with over 80% of CVD deaths taking place in those countries. And And the projections that this will increase to about 23.3 million by 2030. I think a crucial point, most cardiovascular diseases can be prevented by addressing risk factors such as tobacco use, unhealthy diet, obesity, physical inactivity, of course, is important, high blood pressure, diabetes, and raised lipids, but of course, there's nuances within lipids, as we've already discussed. I'll move on from that. So again, Dr. Plou's very, I think, in his presentation, highlighted the importance of atheroma. And this is important to the next point I'm going to come on to about the effects of diet on reducing risk. So on the left, you see here there normal coronary artery, and here we have the plaque that can build up over decades. So when you have a plaque within a coronary artery, the understanding is that when it comes to diet or anything else, it takes decades for that plaque to build up. But at one point, and it's very unpredictable, suddenly that plaque can rupture. When that plaque ruptures, you get an occlusion of the vessel, and it can cause a heart attack, leading to myocardial necrosis. And there are different factors that play into causing that plaque to rupture, which includes smoking, inflammation, obviously, is a factor, and diet, and I'll come into that in a second. But the other thing I want to also emphasize is, as a cardiologist, one thing that a lot of people don't fully kind of appreciate is about 50% of people who suffer heart attacks have no preceding angina. So angina is a symptom that people get when they're walking, when there is a narrowing of the blood vessel, which is thought to be approximately 70%. When they do exercise, whatever, they will get chest pains, and they can get diagnosed, for example, and then treated. But about 50% of people don't have that. Now, there are a number of factors involved, but one of them is that these plaques that build up don't have to be that narrow to rupture. So they could, take a 60-year-old man who's normally reasonably fit, walking around, may have a bad diet or smoke or whatever else. He may have a 30 or 40% narrowing of his blood vessel, which isn't impeding blood supply when he does exercise. But suddenly that plaque becomes inflamed and acutely thrombosed, and that reduces blood supply to the heart muscle. That's quite commonly seen in smokers. So a lot of smokers that come in have no preceding angina, and that's because of the inflammation. At one particular point, that plaque has ruptured and caused a myocardial infarction, which means there are a lot of people who are at risk, clearly, but may not be identified until it's, in some cases, too late. So how does diet fit into reducing risk in terms of cardiovascular risk? We know that there's good evidence that, well, first of all, just going back to underlying pathological process preceding most coronary events normally takes many decades to progress. That's true. And we know that from autopsy studies, even from children who are obese and children that may have died. We've seen that there are fatty streaks in the arteries from that. Most cardiovascular events still manifest after the age of 60. But the perception of a process that will progress slowly and reverse slowly is completely wrong. There is very good evidence and trial evidence that shows substantial reductions in mortality can occur within months of decreasing smoking and within 1 to 3 years of dietary changes. So even if you're at risk, if you make the right lifestyle interventions, you can reduce your risk of having of death and a heart attack very quickly. So one example to talk about smoking, a place in the USA called Helena, Montana, they introduced smoke-free legislation in 2002, and within 6 months there was a 40% reduction in hospital admissions for acute coronary syndromes for heart attacks. Within 6 months of introducing that legislation. Interestingly, that law was rescinded and the heart attack rates went back to their previous levels. When smoke-free legislation was brought into Scotland, 17% reduction in hospital admissions within a year, and 6% of out-of-hospital cardiac deaths also happened within 1 year of regulation, basically getting rid of the smoke, kind of the environment which was polluted with smoke in many public places. Now, coming on to diet, randomized trials also show the same things, that changes in diet can rapidly reduce risk. So DART trial, 2,000 patients, randomized trial, post-myocardial infarction, had a heart attack, eating fatty fish, and this within about a year, led to a 29% reduction in all-cause mortality. There's no bias there. You cannot put bias within mortality. You're dead or you're not. There's not a kind of a heterogeneous, did you have a small heart attack, a large heart attack, et cetera, et cetera. It's a great Italian study also, GISI prevention study, over 11,000 patients, and again, randomly assigned to omega-3 in particular, showed that there was a massive, significant reduction in mortality within 6 to 8 months, and also sudden death. Right, in terms of policy interventions, so CVD prevention policies are evidence-based and are effective. So just very quickly, in terms of causal pathways, upstream interventions have much bigger effects than downstream and help the downstream effects. So, for example, food, salt is linked to blood pressure, trans fats, dyslipidemia, that's already been mentioned. Salt policies work. So in the UK, we had a voluntary agreement with the industry, which has had some effect for sure, but not as effective as Finland, where they had regulations where they managed to reduce salt consumption from 14 grams a day to 10 grams a day. And if, for example, if and to give you perspective, in the UK, reducing salt from 8.6 grams consumption to 5.6 would reduce 14,000 to 20,000 CV deaths per year, just on that alone, which is really, I mean, that's massive. Saving 350 million pounds a year as well. Trans fats, again, hidden in a lot of foods, nasties. Again, UK voluntary policy reducing from 2% to 1% of energy. In Denmark, they had regulations reducing 4% to no, obviously regulation to get rid of trans fats altogether. And again, if we did that modeling, which is published in the BMJ, it shows that if we got rid of trans fats altogether, that would prevent about 5,000 deaths per year. Now, one of my favorite studies, which a lot of you may be aware of, so the PREDIMED study, which was published last year in the New England Journal of Medicine. And this was a randomized control trial, traditional Mediterranean diet with one group, about 7,000 people, supplemented with mixed nuts and also with extra virgin olive oil versus a control diet, which is actually still the Mediterranean diet, but the advice was to reduce fat consumption. So what were the results? Well, so this is again 7,000 people, high risk between 55 and 80, good adherence. Significant reduction, about 30% reduction in risk of heart attack and stroke within about 4.8 years on the group that had extra virgin olive oil and had nuts, which is really quite dramatic. I mean, it's quite amazing. So again, just seeing here, if you just, if you just see here, if you look at the two groups, the control and the intervention group, this reduction in the primary endpoint of stroke and heart attack happened even within a few months. Again, emphasizing that changing your diet, wherever you are right now, to one that has the best evidence base for heart attack and stroke risk will have a big effect on your risk reduction. Putting it in perspective in terms of population, this is a population-wide problem, therefore interventions that are population-based are going to have the biggest impact. So in the United States, for example, if, for example, people increased just one portion of nuts per day within your diet, if everybody did that, we'd save about 90,000 deaths from CVD per year, 90,000. You can see that from whole grains, fruit, and the impact of all these things. Reducing trans fats, for example, eating more seafood, it's pretty dramatic. And at this point, just a special thanks also to Professor Simon Capewell, who's contributed to some of these slides, and also Robert Lustig, which I'll come on to in a minute. Right, health impact pyramid, just to give again, broader perspective about what can we do that's going to really impact on population health. Well, if you look at this pyramid here, socioeconomic factors still predominate in terms of these are the biggest effects on health, and as you go up the pyramid, it has less of an impact. One-to-one counseling, is important, of course, we need that, but in terms of population health, again, changing the context, making the default decisions healthy, and that, involves legislation, and that will obviously come onto food as well, will have the biggest impact on health. So again, just emphasizing that point that, policy-based interventions tend to be more effective, reaching all parts of the population, and not being dependent on a sustained individual response. Right, I know we've only got a few minutes, so I'll just quickly go Action on Sugar, because I'm also the science director of a group called Action on Sugar, which is a campaign group in the UK that tries to highlight the issues around sugar and get it reduced in the population. So very basic terms. So intrinsic sugars are not the problem. In food, glucose is necessary for life. The body doesn't require, now, please anyone challenge me on this, but the body does not require there is no nutritional value in added sugar. You do not need it as part of your diet. Okay? Fructose component specifically has been highlighted by Robert Lustig. There may be obviously some debate around that. I think there's a lot of emerging evidence around that, and I'm not going to go into too much detail, but I think everybody can agree added sugar is not required biologically. We know that observational studies and randomized control trials have implicated sugary drinks with weight gain and obesity. And again, something that is often forgotten, the commonest cause of chronic pain in children is tooth decay, and the single dietary factor driving that is sugar. We mustn't forget that. Nutritional value of sugar, as you can see, 0 of added sugar, no nutritional value whatsoever. Fructose, fructose is not glucose. The sugar is just empty calories. Well, there is evidence suggesting that chronic fructose exposure does promote liver fat accumulation, promotes metabolic syndrome, which specifically is 3 different variations in definition, but 3 of high blood pressure, dysglycemia, increased triglycerides, decreased HDL, and increased waist circumference. Now, coming back to what Dr. Blues also mentioned earlier as well, is that 75 people admitted with a myocardial infarction actually have a normal cholesterol. 66% of those admitted with a myocardial infarction with a heart attack have metabolic syndrome. And that, in fact, if you have metabolic syndrome, your mortality is increased, or hospital readmission is increased within 1 year of being admitted. So metabolic syndrome really is the issue. Yeah, almost done. So exclusive view of obesity and metabolic dysfunction. It's not just about obesity, because actually 40% of normal weight people will develop the diseases of the metabolic syndrome. That's a lot of people who are potentially at risk and at sick. We're all vulnerable. It's not about this person's overweight or obese. We're all vulnerable to poor diet affecting our health. The fiction, right. So the common theory is all calories count. This is what Coca-Cola say. But some calories cause disease more than others. I think that's fair enough to say. Different calories are metabolized differently. A calorie is not a calorie. Fiber, protein, fat, and fructose. A quote from David Haslam, chair of the National Obesity Forum in the UK. It's extremely naive of the public and the medical profession to imagine that a calorie of bread, a calorie of meat, and a calorie of alcohol are all dealt in the same way by the amazingly complex systems of the body. The assumption has been made that increased fat in the bloodstream is caused by increased saturated fat in the diet, whereas modern scientific evidence is proving refined carbohydrates and sugar in particular the real culprits. EPIC study showed 1 sugary drink a day, European study, increased the risk of type 2 diabetes by 22%. And almost finished now, sorry. A study also in America carried out, Stanford also showed that for every 150 calories excess of sugar one consumed compared to calories from another source, there was an 11-fold increase in the prevalence of type 2 diabetes, independent of body weight, independent of physical activity. So that suggests that if you're consuming too much sugar, even if you're jogging every day and are active, you're still increasing your risk of harm of getting type 2 diabetes. I think I'm about to finish now. So just one final thing is that there is a problem with the labeling of sugar in Europe and in the UK, which is which I find very quite disgraceful. Is that if you look here, a can of Coca-Cola we know has about 9 teaspoons of added sugar. On the label, it says this represents 39% of your guideline daily amount of sugar. Just think about that for a second. That suggests that you can have 22 teaspoons of sugar, added sugar a day, as part of your guideline daily amount. In America, they do not consider sugar a nutrient, therefore they have no RDI, therefore it's even more difficult for consumers to know how much they're consuming. But the World Health Organization has now come out with recommendations saying there should be a limit, not an amount that you should have, a limit of 6 teaspoons of added sugar per day. This is something we really need to work on with the European Union and try and get this labeling changed, because I think it's an absolute disgrace. Fine. And final slide, I know I've challenged a few conventional views here, but just to finish, on this quote by John Kenneth Galbraith, because some of you may hear him say, what is he talking about? I disagree. I've had to challenge some of my own beliefs. Faced with the choice between changing one's mind and proving there's no need to do so, almost everyone gets busy on the proof. Thank you.